Hi, welcome to Buzz, the Midwest Underground Business Voice. I've got Dr. Michael Cassaro in the studio today. We're here in Louisville, Kentucky. I'm working on my Louisville. How's it doing?
It needs some work.
Needs some work? All right. Yeah, Pisons give me a hard time. What are you going to do? So you're a pain doctor, but you have a show called the Painless Living Show. What is that?
Well, it started out as a marketing program for my medical practice.
Okay.
I'm a medical doctor. I've been treating people for 25 years, helping them to get rid of pain.
Okay, so give me a way that you help somebody get rid of pain.
Well, divorce? Or you mean besides that?
Okay.
Besides that, there's some high-tech procedures.
Okay.
Most of them what we call minimally invasive techniques.
Okay.
Involve things like burning little nerves that go to painful joints so you don't feel the pain anymore.
Wow. Okay.
Or headaches, same type thing, can eradicate headaches so you don't have to take medicine.
Wow.
My tagline is I want to help you lead a pain-free, medicine-free, and doctor-free life.
Wow. That's pretty powerful right now. I mean, especially in a society that's been conditioned to pop a pill to try to feel better, right?
Absolutely.
And so there's other ways to make that happen, right? And that's why you went into practice.
Yeah, what happens is people have to take a choice between do I suffer with the pain or do I suffer with the medicine?
Yeah.
And it's a trade-off, pain for side effects.
Yeah.
So this is an alternative that involves no side effects because we go right to the cause of the pain and eliminate it at the source.
So what are some of the things that you can help people with that are just so no-brainer that they need to come in and see you? Like it's like, there's a lot of things you can help with, but those one or two things that just make all the sense to come do a consultation with you.
Well, the top two, without a doubt, are people that have chronic headaches.
Chronic headaches.
And people that have diabetic neuropathy.
What is
or
that?
Any type of
diabetic neuropathy. What is that?
That's where the nerves start going haywire and you start feeling pain, usually in the hands or feet, without anything causing pain.
Really? It's because the nerves have damage.
That's right.
Okay. So if someone's dealing with chronic headaches all the time, and I've never been around that till about 6 months ago. I have a friend that's that tunes out after a migraine. I mean, like they're out of the game. And I've never even seen that before, but they can really shut someone down. Someone that's healthy, someone that's vivacious, someone that wants to enjoy life. I've always thought of it, the guy just needs to take some aspirin and get over it, right? But
it's a little worse than that.
It is tremendously worse than that, and there are a lot of people really suffering.
That's right. It's actually a significant cause of disability.
Mm-hmm.
People that miss so much work that they can no longer maintain a job.
Mm-hmm.
And the Social Security Administration actually recognizes what's called chronic daily headaches as a possible source of disability.
Okay, so they can come in and see you, and what does your process look like? You're gonna ask them some questions and give them some tests. I mean, what happens?
Well, I'm an MD,
Okay.
and just like most MDs, I do an initial evaluation.
Okay.
The difference is that I spend usually at least an hour face-to-face with a person on a first visit. It includes a thorough physical examination and probably more questions than they've ever had a doctor ask them before.
Okay.
But it doesn't end there because there's usually some x-rays, testing, things like that, and then new rounds of questions and investigation until we can get to the source of the pain.
Okay.
And then that's where the therapy is focused.
Okay.
And it usually involves looking at multiple symptoms, not just the place that hurts, but everything in the body. Because even though your pain might be here,
Mm-hmm.
it could be caused because of the spiked shoes that they're wearing.
Yeah.
So we look for
There's
the
a yin and yang
cause.
in the body that, I mean, I had knee surgery when I was 25, and it's in the left knee, and now I have hip problems in the right hip, and somebody told me that, right, for that was correlated, and I listened to it, but it wasn't until I started really getting that pain and seeing it and feeling it that I really understand that, right?
And that's exactly the type thing I'm talking about, where a problem in one part of the body causes pain in another part of the body.
Mm-hmm.
And I look for that other part of the body problem.
So, Dr. Mike, what I would what I would probably do with you is probably get you to start to connect and network with people like in the senior living facilities and that are maybe have that have mom and dad going through some of that, right? And they could refer mom and dad to you because mom and dad are not functional because they're going through some of that pain. That could be a good referral source for you. The other way I might push you are other people that are into wellness without medicine involved. The other wellness consultants. Does that make sense? The people that are in the movement that know that are trying to talk about alternative ways to be healed. Does that make sense?
Yes, it does.
All right. Talk to me about this radio show.
Well, the radio show started out as just a marketing device for my medical practice.
Mm-hmm.
But as we started getting more and more feedback, people expressing gratitude through the email and even calling on the air, telling us how grateful they were for information that was being provided over the air that they had never heard before. So that this has expanded. And it's now a form of outreach. And it's growing. We're on 4 stations right now. And as of this Saturday coming up, we'll actually be on the AMC-8 satellite, which is the same satellite service that all of the nationally syndicated radio shows use.
Awesome.
And we're building this network one at a time so that who knows, when the new health care law takes full effect, I may be able to use the radio show to finance my practice of medicine as a hobby.
Nice. Good job. Wow. And all came from really your passion to help people live a pain-free life. I mean, I think that's what is the circling theme that we keep hearing to entrepreneurs that are really making a difference. They found their passion, they chased that, they created opportunity that wasn't seen before. And I think that's what you're doing here.
Yes, it is. There's a finite number of people that I can see one-on-one in my office. But over the radio, I can get real helpful information to a whole lot more people than I could ever see.
Cool. Dr. Mike, you've been buzzed. Paisan.